So you're having hip and glute pain with sharpshooting pain that's going down the leg into the calf. This might be why. When we've got sharpshooting pain with the absence of lower back pain, a lot of time we've got something called piriformis syndrome. And so what piriformis syndrome is when the sciatic nerve is passing over a very tight and contracted piriformis muscle and is causing compression on the sciatic nerve as it passes down the leg, giving you sharp shooting, numbness, tingling, and symptoms that are going down the leg into the calf. With piriformis syndrome, you're usually going to feel relief when you cross the leg over here because it's lengthening that muscle and giving some relief on that sciatic nerve. The piriformis attaches from the sacrum and goes to the lateral aspect of the femur, and its primary function is external rotation of the leg. A lot of people who get piriformis syndrome get it from spending a lot of time sitting with their legs crossed or from driving with their toe out on the gas, and they end up walking like this with one foot toed out. So for treatment, what we want to do is release all the joints that are in the pelvis that can help relax the piriformis muscle. So the closest joint is the sacroiliac joint. It's between the sacrum and the pelvic bone here. We also want to adjust the hip joint here. And then we want to adjust the pelvis in the center here. It's called the pubic symphysis. What this is going to do is help relax and give that piriformis some play. And then on the back end of treatment, what we want to do is strengthen the antagonistic muscles to the piriformis, which are the hip adductors, adductors. And what those do is internally rotates the leg. And this is going to help keep that piriformis from getting too tight. This is a form of a muscle imbalance. Piriformis is usually something that took some time to arise and will take a couple of visits and some time to heal itself and for the muscles on the inside of the leg to keep that toe back straight. So if you're having some hip pain with the absence of lower back pain and symptoms that are going down the leg, book an appointment with me and we'll take a look and see what's the cause of your pain and give you a treatment plan to get you back on the road to good health.